Okay. All right. Well, I think we'll go ahead and get started. My name is Rocky Yap. I'm the current president of the DuPage County Medical Society. Thank you for all of you who've joined. This is really a low key meeting. We have a lot of people joining us from across DuPage and several people from outside DuPage. So I'm really happy that all of you joined us. I'm speaking on behalf of the DuPage County Medical Society. We are a 100-year organization, and we have been representing physicians in DuPage County for over 100 years. And we are proud of what we've done, and we are proud to have programs like this and many other ways that we help provide services and advocacy for physicians and all the patients that we treat. So we'd love for you, if you're interested, to join. And on the end of the slide, we'll give you the website where you can easily join or find out ways to get involved in sort of their political actions that we do, our public advocacy, our charitable work, and just some great networking to help promote our colleagues in DuPage County physicians. So I'd like to introduce a friend of mine for, I guess, over 25 years. It seems like only yesterday. Rashmi is the chief medical officer of DuPage County Department of Health since 2003. She's a graduate from Wisconsin Medical School, and she completed her family residency medicine right here in DuPage County at Hinsdale Hospital, where I first met her years ago. To show you how brave she is, she's actually golfed with me, and she has survived to talk about it, showing her courage. But more importantly, she's also got her master's in public health and policy from University of Illinois, Chicago, and really has been an outstanding chief medical officer for all of us who've looked to leadership and guides. Rashmi has just been a wonderful advocate for physicians and public health in DuPage. And as a reflection of that, Governor Pritzker just recently had nominated her, and she's now on the board of public health, Illinois Public Health. So we're really proud of Rashmi. We look to her for leadership. She's been doing an outstanding job during this crisis. And so the DuPage County Medical Society asked her to give a presentation for all of us so we can learn a little bit more about what's going on from her perspective and what she's been doing to help make this reality. So Rashmi, I'd love to turn it over to you. Kate, if you can give Rashmi control of the slide deck, and we'll get her presentation started. After Rashmi's presentation, we'll have a little roundtable discussion. My friend Valerie Phillips, I'll talk a little bit more about her. She's a leader at Good Samaritan Hospital, and we'll be talking a little bit more about what we're doing on the county level and updates from the front line, so to speak. So Rashmi, please go ahead and take over.
Great, thank you, Rocky, for your very kind introduction. And it's my privilege to join you all this evening to give a brief overview of COVID-19 vaccine and distribution in DuPage County. It's actually a momentous day today. We'll talk a little bit more about this soon, but COVID-19 vaccine just arrived in DuPage County today. So excellent timing for our overview today. All right, so Kate, I think, is going to be helping me navigate. Kate, can we have the full screen? Let me see. I think I've got it. And if you could please advance to the next slide. Thank you. So just to give you an idea of where we're starting with regard to a new vaccine, influenza vaccine is something that we've had, fortunately, for many years, and it's been routinely recommended now, or universally recommended, I should say, for all persons 6 months and older for about 10 years. And even though it's broadly available and accessible, and for healthcare personnel, it's improved because of requirements and mandates in healthcare settings from a patient safety perspective. But for the general population, we're lucky if we break 50% as far as coverage levels across the United States. This is a national graph of coverage levels of influenza vaccination. The darkest line reflects overall coverage levels, and then it's broken down by race and ethnicity. And you'll see for a variety of reasons that vaccination coverage levels lag in several populations. And like I said, we're lucky if we break 50%. So we know for herd immunity for COVID-19, we at a minimum want to reach 70% and higher if possible. So luckily, I think some national surveys are indicating that at least overall, just about 70% or maybe even a little higher, and most recent surveys are indicating that that they would be receptive to taking the vaccine when it's available to them. But we still have a lot of work to do in helping to build confidence. And next slide, please. So as I mentioned, influenza vaccine we've had for many years. COVID-19 vaccine is a new vaccine for this new pandemic. And initially it's an adult-focused platform, just given where the brunt of impact has been experienced in adults, particularly elderly adults, and those working the front lines in healthcare and essential services. So we need to think outside the box and look at shifting tactics. So we certainly want to make sure that we are, like with any issue, any health-related issue in particular, we want to be addressing this with empathy and transparency, not only with our patients, but with ourselves, with our colleagues. Also very important to address concerns among healthcare providers, because we not only want to build confidence toward increasing receptiveness for healthcare providers to be vaccinated, but to then convey a strong recommendation to patients, because healthcare providers are the most trusted source for health information. And that's something I think that's been true, excuse me, for decades. And we certainly want to not only foster that relationship, but really apply it as much as relevant and as much as can be helpful in helping to break the cycle of transmission of COVID-19. And then finally here, very important to engage with individuals and community leaders and community organizations and leaders to help make sure that we are disseminating clear and accurate information to help build trust and confidence in vaccination and help, again, break the cycle of disinformation that often circulates about vaccines, and particularly a new vaccine. Next slide, please. So this is CDC's strategic framework that's customized a little bit now. They've had a framework to vaccinate with confidence, and then now it's been customized very appropriately for COVID-19 vaccination. So there are really three prongs to it. One is that we want to reinforce trust. And again, through clear and accurate information, we want to build trust in the vaccine, the vaccinator, and in the system. Very important to make sure that people are aware of that, that no shortcuts have been taken. This has been after a very thorough evaluation of all available safety and efficacy and quality data. So it has been a compressed timeline, but much of that has been much of that has even been possible because of the new mechanism in place. The fact that it's an mRNA vaccine, it's a new mechanism for a vaccine, but it's been studied for over a decade in cancer vaccines and other platforms. So certainly something that's been in review, and this seemed like the perfect opportunity, though we would never wish for this, but thankfully we, in a matter of months now, have more than one vaccine coming to fruition. So reinforcing trust, very important. Also critical to empower healthcare providers, as I was mentioning, to make sure that healthcare providers themselves, ourselves, feel confident and with conviction to proceed toward getting vaccinated, but then also can recommend vaccination to patients. Only when we have all eligible, it'll be a phased approach, certainly due to limited supply in the beginning, but we really want to make sure that no vaccine goes wasted and that all eligible persons are at least offered vaccination and ideally are vaccinated. And third item here is, again, to help build trust, we need to engage communities as well as individuals, having bi-directional communication, make sure that we're providing information, but also receiving input and then collaborating to help build trust in an equitable way that's culturally, linguistically, racially, ethnically, and culturally compliant and accessible to all. Next slide, please. So as you've been hearing, the Advisory Committee on Immunization Practices has been very busy lately. They had a routinely scheduled meeting in October and then have had some emergency meetings scheduled in recent days. This meeting was on December 1st, where they approved the Phase 1A priority groups to be healthcare personnel and residents of long-term care facilities. And then on December 3rd, this was published, these recommendations were published in the CDC's Morbidity and Mortality Weekly Report, which is pretty unprecedented to have a 2-day turnaround time. Normally it's 4 to 6 months before something is officially adopted and published like that, but this has been vetted for a long time. And in the interest of expediting, again, once it's almost more just the paperwork that was being approved to make it an official CDC recommendation, because before that, after it's an ACIP recommendation, it's considered provisional. And once it's published in the MMWR, it's considered an official CDC recommendation. So fortunately, and it was issued as an early release, which is not uncommon. They often, if there are, issues of urgency that need to be addressed and either communicated or adopted, it's not unusual to have an MMWR early release issued, and that was the case for these recommendations. And then, as you also likely heard, this past weekend, I think it was Saturday, that the ACIP met again, specifically on the Pfizer. So Friday night was when the FDA issued their emergency use authorization. And then Saturday was when the ACIP met to review the data and then ultimately did vote unanimously to recommend the Pfizer-BioNTech vaccine for all eligible persons 16 and older. And then that was actually published on Sunday, the 13th, in the MMWR. So that now is a further refined recommendation. And I'll tell you, the CDC did have a webinar that I do include the link to those slides, which are quite informative from Sunday afternoon. Next slide, please. So just to give you an overview of the vaccines that we are anticipating initially, both, as I mentioned, are mRNA vaccines and have very high efficacy in the trials, and we anticipate high effectiveness in application. Both happen to be 2-dose series. The Pfizer vaccine is administered day 0 and then day 21, so a 3-week interval, and then the Moderna vaccine has a 4-week interval or 28 days. And then, as you've also likely heard a lot about, Pfizer does have some logistical challenges, but nonetheless not insurmountable. It does require ultra cold storage, and then Moderna can be accommodated with standard freezer storage. Pfizer has been approved and received emergency use authorization on, so they met and reviewed all the data on December 10th. The authorization was issued December 11th. And then on December 17th, tomorrow, actually, Moderna will be considered for EUA by the FDA. And then we anticipate, hopefully, ACIP voting on the Moderna vaccine as well in the coming days. Next slide, please. So the priority prioritization groups that are listed here, so far, it's only the bottom left corner, phase 1A, that has been officially adopted and recommended. The remaining phases are also going to be considered in the coming days, but right now for phase 1A, given the limited supply that we all have, it's healthcare personnel and long-term care facility residents that are our focus for vaccination. Next slide, please. So specifically the proposed groups within phase 1A for healthcare personnel, and these estimates here are national. We estimate there are 21 million healthcare personnel in the United States and 3 million long-term care facility residents. And this includes, all healthcare personnel, really anyone who works in a healthcare facility, direct or indirect, paid or unpaid, and, depending on the degree of exposure, there is some sub-prioritization happening in different health systems to help make sure that, for example, persons who staff the COVID unit are vaccinated first. And actually the vaccinators are prioritized to receive vaccine initially, and then in addition, long-term care facility residents along with staff, and then really any healthcare professional who works in outpatient settings, pharmacies, emergency medical services, as well as public health. And there are a variety of long-term care facilities, such as skilled nursing, assisted living, and other settings of congregate care and residential care. Initially, since we estimate in DuPage County, so nationally there are 24 million total who meet the phase 1A criteria. Now, in DuPage County, our estimate is 58,000, with about 43,000 of those being healthcare personnel. And it's about 15 to 19,000 that are long-term care residents. Now, the allocation that we began receiving today is focused on healthcare personnel. Long-term care facility staff and residents are receiving their allocation through an agreement. It's a federal arrangement called the Pharmacy Partnership Program, where long-term care facilities were recruited and urged to sign up for this contractual partnership with CVS or Walgreens, who will have teams that will be managing the allocation and then providing and administering vaccine on site at these long-term care facilities. So you can imagine how complex an operation that will be. And I believe that program is starting the week of December 28th, and they anticipate completing administration of vaccine in all long-term care settings in Illinois in the subsequent 4 to 5 weeks. So hopefully by January, we anticipate all long-term care settings being addressed, and then similarly, vaccination of healthcare personnel will be beginning this week, likely tomorrow in many health systems, and then we'll expand from hospital-based settings to public health and other settings in the coming weeks. Next slide, please. So just wanted to review a timeline. We talk about all these dates, and sometimes it's just nice to look at it visually. So you'll see here on this timeline that Pfizer is blue, Moderna's red. So we have the December 10th review date last Thursday, and then it was distribution began after the ACIP and CDC recommendations. So this week it's being shipped, and people in health systems are receiving their allocations. And then the FDA review occurs tomorrow for Moderna. And then, the subsequent necessary meetings will occur likely over the weekend again. And then we anticipate distribution, if all is approved or authorized and recommended for Moderna, then we anticipate distribution next week. So at this time, it's been, I think before we started, Val, you were saying it's a lot of hurry up and wait exponentially. I think that's an accurate summation of our state at this time, just because it's been, we were initially anticipated in DuPage County to receive an allocation of 16,000, and then that, changed. We were told all along it could change. At least it's not dramatically lower. It's about, I think, 13,650 or so. And but nonetheless, and we don't know yet what we'll be receiving next week. And then we anticipate receiving weekly shipments by the end of December for the duration, really, until we complete vaccination of all of our eligible groups. Next slide, please. So what we do know is that DuPage County has a dubious distinction of being among the 50 counties with the highest death rates per capita. We, like many others, have been very significantly impacted. Many of our residents have tragically died. We have very high levels of hospitalization and also very high levels of case activity. So, but just based on our mortality rate per capita, we met the criteria to receive some of the initial allocation in Illinois. So the original plan, at least for DuPage County, was that vaccines would be shipped to the regional hospital coordinating center. There are 10 that are throughout Illinois that are receiving allocation, but us, along with some of the other regional counties, the problem with that was that the cold chain was going to be broken, and then after transport, all the vaccine would have to have been administered within actually 4 days. I mean, definitely within 5 days, but 1 day is kind of lost in transport. So in order to address that, again, another benefit of collaborating with our health system partners was that we were able to work with the state of Illinois, who then agreed to ship directly to DuPage County. And so through a partnership with DuPage Medical Group, since they fortunately have expansive ultra cold storage capacity, we've been able to have the DuPage allocation, at least for healthcare personnel, provided to or shipped to DuPage Medical Group. And then the DuPage County Health Department is responsible for coordinating transport of vaccines to our local health systems, which will be occurring tomorrow. And it's Illinois Department of Public Health that determines the portion in the initial allocation for DuPage County. It's not at the county level, it's very much at the state level. So we keep waiting on information from them. And then once we have it, then we can act on it and share it and get the vaccine out and into people's arms. Next slide, please. This is just a geographic distribution of the 50 counties that met criteria to receive vaccine through the initial allocation. And then here it actually shows what previously was determined, for us to receive our vaccine through Loyola. But then, as I mentioned, just in recent days, we were approved to receive vaccine directly in DuPage County so that we can maintain the ultra cold storage requirements so that it doesn't limit, we can certainly maintain it beyond 5 days. Next slide, please. So what we're currently working on in DuPage County is, finalizing and implementing now the initial allocation plans, and not only for transporting to our health systems, that's very much the initial priority. And then our team has been very actively planning and coordinating logistics for our point of dispensing locations, or pods. And we do anticipate these pods to be scheduled in the coming 2 to 4 weeks. They'll be appointment based. They will largely be following a drive-through medical model. Mass vaccination with COVID-19, or during the age of COVID-19, really presents some unique challenges, because very different from H1N1, as you may recall, we had mass vaccination clinics where people were in kind of organized mazes, kind of Disney style, and, worked through the line, and you could come with your family, and there were frankly large gatherings of people, which in this day and age we the last thing we want is for a vaccination clinic to become a super spreading event. So that's why, similar to testing, when individuals are being tested at a community-based testing site or through a health system testing site, it's a drive-through model to really help minimize exposure and to have it be outside, and again, minimize exposure not only for healthcare personnel, but also other patients in the healthcare facility. So that's the model that we intend to implement. And then, so again, our goal is to make sure that all 58,000 who are indicated to receive vaccine in phase 1A are vaccinated. And again, our initial priority is disseminating vaccine allocations to our hospitals. And then the focus of our DuPage County Health Department pods are healthcare personnel who are not affiliated with a health system where they're already providing vaccinations. So for example, emergency medical services or independent practitioners, we want to make sure that that everyone has access to vaccine. And we do encourage anyone who has an affiliation with a health system to make sure you're accessing vaccine through those mechanisms. I know many communications have been going out since last week and this week for healthcare personnel to begin scheduling appointments. And so we would strongly encourage anyone who does have access to COVID-19 vaccine to be vaccinated through those routes. And then for anyone who doesn't have access, we anticipate having more information about scheduled drive-through clinics in the next 2 to 4 weeks. And again, we appreciate everyone's patience and understanding because the information and situation is rapidly evolving. So we will certainly keep you posted, and we do provide a few links that we encourage you to keep checking as well. Next slide, please. With regard to safety and monitoring, there's a well-established, you're likely aware of the VAERS system, which is Vaccine Adverse Event Reporting System. This, again, is an opportunity for any adverse effects to be reported, whether it's by the clinician or by the patient. And then next slide, please. There are other mechanisms in place. So VAERS is in the top row, and then the second row is VSafe, which is it's a CDC managed monitoring system online primarily that is being stood up specifically for COVID-19 monitoring, and recipients will receive alerts and reminders and sort of check-in communications at specific intervals after vaccination to help track their progress and their response. And then there are a variety of kind of longer term monitoring systems as well. Next slide, please. And then just for your reference, Chicago Department of Public Health has some criteria established to help any health systems sub-prioritize, again, with that limited vaccine supply within a hospital, for example. So the criteria to consider would be, does the individual have direct COVID-19 or person under investigation patient care? Do they have exposure to aerosol generating procedures? Do they have direct contact with contaminated material? So accordingly, we thought this was just a helpful tool for anyone who may need to consider prioritization. Next slide, please. So for implementation, some things to consider are certainly access, and we're fortunate to have wonderful healthcare systems in DuPage County where public health and our health systems are working closely together to make sure that persons who are not affiliated, as I was talking about, not affiliated with health systems will have access to vaccine as well. And then based on the anticipated reaction of systemic symptoms such as fever or headache or fatigue, very important for personnel to not all be vaccinated at the same time from a particular unit. You want to stagger vaccination by, for example, 3 days, so that you have one group that is vaccinated, and then they can ideally be vaccinated, like say on a Friday, before they have a couple days off, or depending on their schedule, ideally before they have a couple of scheduled days off, so that they can kind of observe and monitor and then be assessed as needed. Since if they develop a symptom that could potentially, screen them positive for COVID-19, then they may need to be evaluated for that. But let's see. Yeah, and there is some additional guidance that I've included the link to at the end. Next slide, please. And here we are. So CDC resources. If you had no time and wanted to know what's the least that you should check out, it's these 3 links. These are all very recently posted guidance from the CDC. The first one is the slides from the presentation, or from the webinar on Sunday, right after the CDC had published the recommendations. So it's just an excellent slide deck that kind of walks you through many of the most important points, I think, to understand about the COVID-19 vaccine, or at least the most recent, the Pfizer vaccine. And then the second is a COVID-19 vaccination communication toolkit for healthcare personnel, to not only help understand it ourselves, but then how to communicate with healthcare personnel to be receptive and understanding of the vaccine, and then how to convey those messages to patients as well. And then the third is also very important for implementation, post-vaccine considerations for healthcare personnel, which is a little bit of what I was talking about, that you want to make sure that you're staggering individuals, so not everyone from one unit is getting vaccinated at the same time, so people don't all need to call off because of being symptomatic or anything. So again, I would strongly recommend checking out these links, and then also explore the other headings, in the left margin, because there are just a lot of good resources. But again, I would just strongly recommend prioritizing these 3 to start with. Next slide, please. So as I was talking about post-vaccine considerations for healthcare personnel, this just has a little bit of the information in the overview of that third link in the previous slide. So just kind of some of the symptoms that have been reported, that generally they're mild to moderate in severity. They occur within the first 3 days of vaccination, which is the day of vaccination and the following 2 days, with most occurring the day after vaccination. They typically resolve within 1 to 2 days of onset, and they're more frequent and severe following the second dose, so 3 weeks after the first dose, and among younger persons compared to those who are over 55. And then just for awareness, the symptoms that are typically associated, or at least observed in the vaccine studies, were systemic: fever, fatigue, headache, chills, myalgia, and arthralgias, in addition to local vaccine administration site soreness. As the last bullet outlines, cough, shortness of breath, rhinorrhea, sore throat, or loss of taste or smell are not consistent with post-vaccination symptoms. So if those symptoms are present, then evaluation for COVID-19 may be indicated. Next slide, please. I think this is the last. That basically it can be challenging to distinguish, and the site gives you there's a table that helps walk through, based on these symptoms and exposure history, that what we want to make sure we're avoiding are the negative consequences for healthcare personnel, patients, and long-term care facility residents that might disrupt services. We want to make sure we're limiting unnecessary work restrictions, while also avoiding inadvertently allowing healthcare personnel with SARS-CoV-2 or another transmissible infection to work. Next slide, please. This is just some information for how we can better educate and prepare our patients. Next slide, please. And this is our DuPage County Health Department COVID-19 vaccine page. We'd encourage you to check this out. There's you can sign up for a weekly newsletter, And we continue to have new information posted there. And I think that's it. Next slide, please. Yes, thank you so much for your attention, and happy to, actually, I think we'll turn it over to Rocky and Val, and then that link on the final slide at the bottom is a press release on today's receipt of the first vaccine shipment, and has a little link in there also to some video footage. Thank you.
Rashmi, that was outstanding. Thank you so much. Great presentation. We have, as you'd expect, a lot of questions from our colleagues, and I'll get to those in just a few minutes. Before we do that, and I promise we'll get to all these questions that are coming in, I invited a great friend of mine, Val Phillips, who I've known almost since I started practicing out here, which means we're both very young. But Val is, and she's in the front lines on trying to help distribute the vaccine at Good Samaritan Hospital. We invited some of the other leaders of the other hospitals. They had conflicts, unfortunately, and Val, being the kind person she is, she agreed to come and briefly talk about. So what I'd like to do is have Val just talk for a few minutes about how things are going at Good Sam. I think in the we're going to have future talks on this in the months to come, sponsored by both our DuPage County Medical Society and DuPage County Health Department. So we'll have more of these discussions and maybe talking about bigger pictures that goes on. But Val, maybe if you could, again, an outstanding physician, ER physician, and really an important leader at Good Sam. And Val, maybe give us a rundown on how things are going at Good Sam.
Sure. Thank you, Rocky. Really, I can only speak directly for Advocate Good Samaritan, but I've been on calls with Rashmi and her entire team going back to the beginning of March with the healthcare systems in DuPage County, and these calls have stepped up recently again with the surge, and then now to twice a week because of the vaccine. And the other hospitals in DuPage County are following a very similar plan, and much of it has to do that we're all on Epic as an electronic medical record. So what our process has been is like I had told Rashmi before this call started, it's the hurry up and wait to an exponential level, because the original plans that were coming forward from the state were potentially that the vaccine was going to be distributed to the healthcare systems and the county. So we had a process within Advocate Aurora Healthcare, to have it trickle down through our hospitals, et cetera. All that got pivoted last week. And the health department really stepped up to try and keep us in the loop as far as how this was going to go. And then really helped us, we're calling ourselves a coalition now of the DuPage hospitals, helped us put forth a message to IDPH that, we would do anything that we could to get frozen vaccine at least delivered to DuPage County. From there, as soon as it goes out to the hospitals, it's in the quote thawing phase, but that was ultimately successful. But in the meantime, we had first anticipated that we would have vaccine perhaps as early as Tuesday and then Wednesday, and now it's going to be Thursday. Each of us had a process put together where you put out a schedule and then emails to your associates to basically schedule an appointment for the vaccine. So that went reasonably well. There were some glitches, and I'm hearing that there were glitches at each of the hospital sites putting that information out. And we had put it out to, in that group 1A, most of us had to create 3 tiers within group 1A so that we were selecting our patient-facing team members, especially in COVID care areas first. But that had many layers. It included not just the clinical personnel, but also, EVS personnel that was in there. Diagnostic imaging is going in to do x-rays and that sort of thing. Some of the supply service personnel that have to be on those units. So all of those were arranged into tiers within that group 1A. Then we had to cancel appointments because we didn't have vaccine on Tuesday. We didn't have it today. We won't have it ready to administer 6 a.m. tomorrow morning, which is when our clinic slots start each day. So everybody's just, gradually adjusted and, sending out all these emails. Okay, we need to cancel your slot. Please reschedule. Oh, we need to cancel again. Please reschedule. So you know, the patience on the part of our team members, I think, has been extraordinary so far, trying to cooperate with the process. So ultimately for us, tomorrow our clinic starts. I actually, while Rashmi was talking, just got a confirmatory message from DuPage County Health that the vaccine did get delivered to DuPage County safe and sound. It'll still be in the ultra cold frozen state until tomorrow morning when it gets dispatched to our hospitals. So we're starting our clinic slots for the vaccine administration mid-morning tomorrow. And we're actually doing it in an area of the hospital that is a large cafeteria eating area. We've taken over that to create a staging, spot where you confirm your registration, you wait to go into the vaccine rooms, and then you get called into the vaccine room where there's a few stations, and then you come back out to a large socially distanced waiting space, because we have to monitor everybody for at least 15 minutes. And if you've had an adverse reaction to a vaccine before, they're recommending 30 minutes. So we have timers, of which I might pick up more tonight from another store because we're buying them all out. And then if you haven't had any reaction at that point, then you'll be free to leave. And we're continuing to have these appointments from, for instance, the following day from 6 a.m. in the morning till 10 p.m. at night. Because the vaccine isn't coming to us until tomorrow, we're going to be doing the vaccine clinic tomorrow, Friday, Saturday, and Sunday for our team members. And we don't yet know when we're getting vaccine delivery next week, but we may have to, just step right into the next days of schedule. So we're constantly looking for updates all day, every day, so that we know when we can offer the vaccine and how much we'll get, et cetera. We chose a specific amount of vaccine. You could only request in multiples of what the Pfizer tray quantity is, which is 975 doses. So we decided specifically at Good Sam to just take 975 doses, because double that, especially with so many uncertainties, would be really hard to, be 100% sure you could administer all those vaccines and not have them, time out at the end of the 5 days. It gave us a little bit more leeway in that it's not going to be starting the thawing phase until early morning tomorrow. And that'll be different when we start getting the Moderna vaccine. It can be ordered in smaller quantities. It just has to be in traditional vaccine coolers. It doesn't have to be ultra cold. And then lastly, we're working on coming up with a process for how we can vaccinate EMS. Good Samaritan Hospital is an EMS resource hospital, and we have about 20 fire department and private providers in our system, about 600 plus paramedics, not counting EMTs and other personnel within that. And we're figuring out a way to vaccinate them in the most timely, efficient way possible. So that's kind of in a nutshell what I've been doing for the last couple of weeks. If there's questions, I can try and answer, but I don't know the specifics of the other hospitals. I will say that those of us that are on Epic, which is really all the hospital systems in DuPage, the nice thing is that when we're giving the vaccine, they're documenting it right away in Epic, and the appointment was, in Epic, and in so doing, the documentation, there's an interface directly with iCare, which is the state's platform for their database for immunization. So that's quite helpful for us.
Well, Val, thank you very much. That's great. And that's the front line impressions are really important for us, and it gives us more information. As you said, I think a lot of the hospitals in DuPage are working in much the same way under Rashmi and the state leadership. As you expect, we have a lot of questions, and I want to welcome, again, thank all of you who are online. I know it's Vince Keenan, the CEO from Illinois Academy of Family Practice, is online. Please, Vince, feel free to answer questions if you have any. I think it's the first question. Ronald Stefani and I think Eric Roth, Ariel Roth, a few other people have similar questions. And Rashmi touched on this, and maybe Val can also chime in. questions about private practice offices and their staff. How can we make sure that we can, if we're in private practice and not necessarily employed by a healthcare system, how can we make sure our staff is in line to get vaccines, because they're in many ways just as much first line as maybe we are, us. Rashmi,
Definitely.
back on it.
Sure, I can start, and then maybe Val can speak to how they're approaching this in Advocate. But yeah, as I mentioned, the initial focus and requirement really of the allocation is to be going directly to the hospitals, more for healthcare personnel providing inpatient care and more intensive services. And then in the coming weeks, as we receive allocation at the DuPage County Health Department that we can administer to healthcare personnel, our primary focus will be on non-affiliated healthcare personnel. So really healthcare personnel who do not have a health system affiliation or access through a health system. So we anticipate at least knowing the dates of those in the next couple of weeks. And then they will be by appointment and drive-through. And as soon as we have that information, it'll not only be on our website, but we'll make sure it's disseminated through the DuPage County Medical Society listserv. We would appreciate help in disseminating that information to our healthcare community. And then, so in addition to that, then, and I'll segue to, turn it over to Val here, because I think we're fortunate to have excellent partners in DuPage County in our hospitals and health systems. And just on a call this week, last week, when we've discussed this issue, all health systems had agreed to, or at least said that it's possible. And I think what's being figured out is sort of the documentation, because right now, I think, as Val mentioned, most health systems, or at least many, are using Epic. And so, I guess they need to have a mechanism in place to document the visit and the vaccine administration on top of the immunization registry, but the clinical record. So I think as soon as they establish that, then we'll see an expansion of health systems that will also be open to receiving vaccination or vaccine allocation beyond their own needs, so that they can provide it, or with the expectation that they would provide access to non-affiliated healthcare personnel. Thank you.
Val, you have any comments?
So I would agree with what Rashmi's presented. Each of the hospital associations in DuPage County were in agreement that we would try and help out with that. None of us can take it on completely. And one of the things that was talked about a little bit on the health department call, but talked about more extensively on some other calls, is currently we're all at the hospital level dealing with COVID surge. As far as, our COVID units are still open. We actually have a higher surge than what we saw at maximum in the spring. And so it is a bit of a struggle staffing the clinics, because it takes a fair amount of staff to do it, as far as your registrars and the clinical staff that will give the vaccine. And it's clinical staff that has to be registered within Epic to be able to document the vaccine. And we have to have clinical staff that's doing the observing to see if anybody has an adverse reaction, and so on and so on. So we're pulling that staff right now out of our labor pool, and some of our clinical staff that's generally not in clinical roles currently. But we can only continue that for so long, and it's going to take a couple weeks for us even to get through tier 1, 2, and 3 that are in group 1A. So we will probably have to work with the county and see if we can come up with some sort of hybrid model where we've got some assistance from county staffing and some assistance from hospital staffing. And hopefully the surge continues to gradually go down like it has been. But just speaking honestly from the perspective of the hospital staff, and I'm a frontline emergency physician as well, working my shifts during the month, and the staff can't take much more. So I think we just have to be very cognizant of that, and whatever plan we put together, it may have to take, volunteers from the private sector that aren't affiliated with with the health systems, to help bolster this up. But everybody was certainly eager to help figure out a way for it to happen and to get everybody covered, because ultimately that's what's going to benefit the hospitals is, if we reach that point of herd immunity.
Great. Okay. So Daniel Campbell, Mark Jacobson, and Carolyn Morrison, I believe Ushma Patel had similar questions. I hope that answered. If not, please type in again. There's an interesting question here. Rashmi, maybe you can answer this one. Was a question about do workers at county jails fall in that category, and also county jail people in general? But do you have any comment on that?
Sure. At this time, they're anticipated to be covered in phase 1B as in boy. So hopefully in the next phase. This initial phase is focused on healthcare personnel and long-term care facility residents, but the correctional and detentional facility workers, and I anticipate inmates and detainees will likely be covered because it is very much a high risk setting. And as we know, there have been very large outbreaks in different parts of the state and nationally. So definitely a priority group. And at this time it's anticipated, though not finalized yet. I think we'll know for sure in the coming days, but probably the next phase, 1B.
Okay. So Mark Jacobson just wants to ask, can you clarify how the process that Dr. Chugh is discussing will work? As this doctor mentioned, 2 physicians hopefully be vaccinated. How will my staff be able to verify DuPage County Medical Society their employment at my office? And so I guess Rashmi, I'll leave that to you. Is that Dr. Jacobson's concerns? You have anything to add to that?
And I'm trying to find it here. Is it in the chat or the Q&A?
It's in the chat.
Okay. Oh, I see now. Okay. So it says, since my staff are not employees, okay, all my, so the last question is, do you have any further information about how to get vaccine to my independent practice?
Well, someone on that, is there any thought to providing vaccines directly to the independent offices, where they be able to vaccinate their own staff and possibly our own high-risk patients?
So excellent question. And individual practices can apply to be a COVID-19 vaccine provider for their own staff and even your own patients. There are some prerequisites. For example, if anyone is already a registered vaccines for children provider, the VFC provider, then they're familiar with this process. But basically, you need to be registered in iCare, which is the Illinois Immunization Registry, because all vaccine administration, each individual vaccine administration needs to be entered and documented in iCare in the registry. And then you also need to complete a COVID-19 vaccine provider agreement. So there are some hoops to jump through, but not insurmountable. And I just asked the state, because I was looking on their website to provide, like I thought, oh, certainly they'll have a page that it has all this information compiled. And at this time, they don't have a slide for this, but I can make sure to share that back with Kirk so that information can be disseminated. Actually, and I can find it while we're talking here. There is at least a page that has the iCare information where people can start investigating how to register for iCare.
So I'll just go on and say that thank you, Rashmi. That's a great answer. And we are getting some other questions, and I want to reinforce Rashmi's point. You know, the CDC is obviously a great website's a great place, but I'll tell you the DuPage County Medical Society will have all these links available on our website. And as Rashmi pointed out clearly, DuPage County Medical Society or DuPage County Health Department will also have on their website, and we'll make sure to give you that information before we close on so you can access that if you have questions about this. Another question from a good friend of ours: how critical is the timing of the second dose, and what mechanism is in place to follow up on that? So maybe Val, I think you're going to be organizing this at least a Good Sam. Would you have thoughts about that? About documentation
Once again, Rocky?
So how critical is the timing of the second dose? And then the other part of this question is, what is the mechanism in place to follow up on the second vaccination and make sure that within that 3 weeks for the Pfizer vaccine and 4 weeks for the Moderna vaccine?
Okay, sorry, I was answering a county email.
Okay. No problem. Well, I mean, I just wondering how Good Sam is going to be. You said we're going to be using mostly Epic. Will the individuals also have an appointment for their next vaccine when they leave?
Yes. So apparently, one of the issues with Epic is that when we're looking at this model where you're actually administering, quote, a medication or the vaccine, you can't do a dry run with everything. You can do mock patients charts, but you can't actually administer and trigger the whole process. The process that's laid out the way it's supposed to work, and we'll find out tomorrow, is that if you've had your appointment, you come in for your appointment, you've also checked in for your appointment. That's another electronic step you have to do. So people that are used to using the Epic MyChart variety apps, and usually each health system has their own variant. Ours is called My Advocate Aurora, or the smartphone app is LiveWell. Like I said, everybody has their own. You have to make your appointment, and then within 3 days of the appointment, you have to specifically go in and check in for your appointment electronically, asks you another series of questions. Then when you come for this vaccine appointment, they're going to acknowledge your registration, and then you'll go in and get your vaccine, and there's, the general Epic documentation steps there. After that's completed and your vaccine is entered electronically, it will generate the after visit summary, the AVS as Epic calls it. And it is also supposed to generate an invitation and a, quote, ticket for you, electronic ticket, telling you that you need to schedule your second vaccine, and it gives you a window within which you need to schedule that. And then if you're not getting it scheduled, there's supposed to be reminders. In addition, part of the kit that's coming with the vaccine, there's going to be patient cards that you hand them. It will also show the, was it Pfizer, was it Moderna, was it one of the ones that will be coming out later? Which vaccine did you get? And on there, the time frame that you need to have your repeat vaccine. Now, the information, I was on the Pfizer webinar on Sunday, and it said for that vaccine, 19 to 23 days is their range that they feel is acceptable, recommending 21. They did say that if you're outside of that range, you wouldn't have to repeat your series, but that you'd want to have it as close as possible. We haven't been sharing that information to team members. We want them to try and stick to the idea that it should be, as close to that 21 days as possible. And for Moderna, it's 28, and the other pharmaceutical houses have slightly different parameters. Now, they're also going to be looking at having another safety net of, if the vaccines that went out the first time, in 3 weeks, you're not seeing all those people again, is there a report that can be generated of who did not come back in? And then it'll probably be a manual process to try and reach out to them and say, are you coming? Can you not come? Did you get sick in the meantime? Out of town? What's the situation? So manpower that's going to have to be applied to that is kind of an unknown right now.
Sure. I think hopefully you see Rashmi very nicely put 2 links in the chat box. You can get that. And as I said, we'll also make sure we have that on our websites for both the DuPage County Medical Society and the DuPage County Health Department.
Rocky, I just wanted to mention also that there's been a lot of demand, which is a good thing for folks signing up. So there's a bit of a lag. I think they're focused on making sure the hospitals are in, and patients or providers and practices that are at increased risk. But I would certainly encourage you to submit, if anyone's interested, to submit your application and keep checking. Check once a week and ask what the backlog is. I think there is a hopefully a transient backlog, but they're working down it. It normally is not like this. It is really just because of the surge. So I would just encourage you to be patient and keep trying, because it'll be good for any practice to, again, not only vaccinate your staff, but then your patients going forward. So it's an opportunity for the coming months. Thank you.
That's great. So we have so many questions coming up, and I'll try to get as many as I can. Carolyn Morrison is asking, concerns about outpatient mental health have longer exposure to patients. Are you including non-physician mental health workers requiring vaccination sooner than later? Rashmi?
Absolutely. Yes. I mean, definitely within phase 1A, you know, may not be part of the, like, similar to the COVID unit staff, but definitely falling into phase 1A.
Okay. So we have some friends asking questions. Mazalia Soter asked, what are the recommendations to determine the time of vaccine if I can get it, if I can do, excuse me, what is the recommendation in terms of timing of vaccine if I can at times do telehealth? Should we wait for general population or when? So I guess she's saying that she's doing telehealth. Would she be less of a priority? I guess it's sort of hard to answer without knowing further specifics, but Rashmi, will you take a swing at that?
I would still advise that person, that healthcare professional, clinician, to still be vaccinated within phase 1A. Very generous offer, but I mean, you know, a physician can't help others if we ourselves aren't healthy. So I would still encourage vaccination within phase 1A.
So our good friend Lanny Wilson, as you expect, asking for those that aren't on the line right now, but he's asking about medical students and residents, and are they going to be in first line?
Yes, they also meet criteria for phase 1A. They do meet the CDC definition for healthcare personnel.
So our good friend Ray Dieter always has a good question. How long for immunization to be effective after administration? That's from Ray. Ray, he's always asking good questions.
That is a great question, and the short answer is we don't know yet. Like, we know it's effective, you know, at least a few, like 3 months after completion of both doses, but at a very high level. But that's what they'll continue to study, is what kind of protection is offered, and if and when a booster or another vaccine is recommended.
Okay. I'm getting some other, I just want to get to all these questions as much as I can. Again, I just remind everyone, as Rashmi pointed out, there are some great links, and we are planning to have on January 13th, have another discussion. We're going to be inviting some other the hospitals, maybe some representatives from CVS or Walgreens to be involved in this next conversation, talking about some of the problems, and also have other leaders of the hospital and healthcare system involved, people of the caliber like Val represents. So this from Caroline Morrison again. She asks, I signed up on iCare but got stopped because I'm private practice, and they said they have to assign me a code. They are set up for larger healthcare systems. I've heard nothing of them since I submitted the form. You have a comment that any question,
I would suggest calling and following up. I think it may just be a provider code that's required, but still a good idea to call and follow up on that.
Yeah.
And Rocky, I'll say from the hospital perspective, we had to get additional people registered within iCare, and it was a struggle. And I think it had everything to do with there were so many, and are still so many, that have to get registered, and you know, the manpower that's at IDPH that's not been pulled to other duties and still able to do it. The other thing was, it was very difficult to determine whether it had actually gone through, because there's a few steps involved in it. Interestingly for us, Chris Hoff at the health department was ultimately able to see, yep, we see you, your hospital's there, and yes, you're the few people that you signed up, yes, they're there now.
Right.
But it literally was a process that took a few weeks.
All right, I have one maybe last question here. This is from an anonymous attendee. Once vaccinated, does that person's COVID test become positive automatically? positive and then cannot have procedures or surgery? I'm not sure if I understand that question.
That's a good question. No, so the diagnostic test will not be positive as a result of the vaccine. There's no live virus. There's no, and it's actually a good question to understand or to be able to respond from patients too, that, for example, with flu vaccination, people often inaccurately think that they'll get the flu from the flu vaccine, which is not the case. And similarly, they will not test positive or have develop current infection with the COVID-19 vaccine. So from a diagnostic perspective, no. From a serological perspective, yes, we would hope that you would have an antibody response.
Right. All right, so I think I got most of the questions. I just want to thank Rashmi again so much, and Val, boy, what really added a fullness to this presentation. Really means a lot to all of us. As I said before, all these links that Rashmi discussed will be both on DuPage County Medical Society's website as well as DuPage County Health Department's website. Please, I encourage you to look at those. As I said, we're planning to have Lanny Wilson, who is one of the outstanding leaders in DuPage County Medical Society, who's in charge of governmental affairs. After his meeting, we will have hopefully a quick update on January 13th. The invite and Zoom link will be coming soon. So, and we'll have other people signing in for that, other people inviting other people to be involved. But I really can't tell you how much I appreciate Rashmi, a great presentation, and Val Phillips, physician extraordinaire, for taking time to help us out. Thank you again, everyone. Please, as I said, support the DuPage County Health Department. And if you're interested, please look into joining DuPage County Health Medical Society. We need your support, and we're doing a lot of good things. We'd love to have you participate and help support our mission and goal. If there are not any other comments, Val, Rashmi, thanks again. Anyone else, please call us anytime.
Thank you, Rocky.
Thank you, everyone. And there's our
Thank
page,
you.
Connecting Physicians and Improving Healthcare in DuPage County. 100 years. Okay, everyone, thank you very much.
Thank you. Good night.
Good night.
Right. On the table, we're ready to go. Can you turn that light off above you, sweetie?